Hello, my name is Nate Klein. I am a chiropractor at Klein Chiropractic, which is located in Dallas in the Back Mountain. And I'll be talking today about chiropractic pregnancy and your spine and how we might be able to work together to help you. If I mumble at any point, which I like to do, just point at the ceiling and I will look at you and wink and try to elevate my voice. So what do we do as chiropractors? We fix bones that are slightly out of place, which we call subluxation. So you can think of that as like a very minor dislocation. So this can damage the joint tissue, it can irritate, it cause inflammation, it can even put mechanical bone pressure on nerves coming out of your spine. Those are very important nerves, obviously, because they go to every organ, every tissue, every muscle in your body. So you don't want disruptions in the communication from your brain to your body. And you definitely don't want the nerve suffering and dying, because that can lead to organs malfunctioning and muscles atrophying. So we use very light techniques to get that bone back into place. In different conditions we see a lot of muscle imbalance sometimes due to sometimes the joints being out of place, causing one muscle to tighten up on one side more than the other. And then our ligaments, if one joint is pulling on one side, we can have arthritic buildup over years. So we call this more of our micro trauma. Just sitting at a desk or doing something very repetitive over and over again can lead to these subluxations. So a lot of people have these and they don't even know that they do. So go to a chiropractor, get checked out, see if you have any subluxations, because that's important to get them removed for your pregnancy and just your general well-being. Like I said before, the nerves are very important. They come from the spinal cord, from the brain, all the way down through the spinal column. It's fully encased in bone to protect it from forces of trauma. But what can happen is, either over time, through improper posture, the spinal curves can become abnormal, and that can put nerve pressure on there or imbalance your muscles, either front to back or side to side, and can lead to arthritis and degeneration, and the discs get shrunken, degenerative disc disease, and nerve pain, radiculopathies, and sciatica. So what we do is we try to keep the spine, the bones working functionally so they can do what they're meant to do, and that's protect the nervous system. Here's a few research articles I found quickly on chiropractic and pregnancy. This first one here is the baby was in a breech presentation, and they sought out chiropractic care late in their pregnancy, in their 32nd week. And the breech presentation assumed a vertex position after receiving chiropractic care. And that was confirmed by ultrasound imaging. Here's another one with 3 different women undergoing chiropractic care, and they used an activator adjusting instrument. A lot of chiropractors use this on pregnant women because it's very light. It gives a light tap, very specific to the bone. So it's very gentle. So you're not getting twisted up and you're not having your neck snapped back and forth. It's just a very light tap, very specific, but very effective, because 2 out of the 3 women in this research study had their breech presentations go to normal and had normal vaginal deliveries. The third one developed complications and had emergency C-section. So 2 out of 3 is not bad. Here's another one with infertility. So they were unable to get pregnant. Went to a chiropractor. After 8 visits, got pregnant. Pretty cool, right? So sometimes getting that spine back in line, help take pressure off the nerve, allow the hormone regulation, everything to work better. That's very involved with that process because it is very complicated. So even just the slightest hiccup in how your body is operating and those hormone levels can cause pregnancies to fail. What we see mechanically during pregnancies, as the later it goes, the more this lumbar lordosis will increase, because we're getting the bigger belly, right? So that's pulling on this lumbar spine. It's causing this sacrum tailbone to rise, and that can lead to joint pain here and joint dysfunction and muscle imbalance. So we want to get the spine as normal as we can. Obviously, there's a limitation there with the weight. So the idea is we want to strengthen certain core muscles. This is another picture there. We call it lower cross syndrome, or anterior pelvic tilt, when that happens, when the hyperlordotic curve comes forward and the pelvis rotates anterior and down because of the belly. This also affects your shoulders and your neck, so you might have neck pain with pregnancy, and you're also going to have some imbalanced muscles, so you might feel some tightness in certain muscles over others. Here's a back to front view. So what we do as chiropractors, we try to level out these hips, so you can have one hip higher than the other. You can see the sacrum laterally going left or more right, causing different curvatures in the spine, pressure on the nerves, shoulder height's different. So we level you out and give you different exercises to strengthen certain weak muscles that we see and stretch the tight ones. Here's just another picture of that anterior pelvic tilt, so you can feel that bone in the front. Sometimes it's very tender, right? You can search around there in the front, check that bone. If it's tender, you might have either one of these tilts, depending on how your muscles are developed. You can have anterior or posterior pelvic tilt. A lot of times we're seeing anterior pelvic tilt because of the weak abdominals due to the pregnancy and that just the overall, the weight being forward. And there's another picture, so you can see that lordotic curve and the pelvic rotating forward. Here's just another one. This one shows some of the muscles. So we got the very tight erector spinae in the back and that very lower back attaching from the pelvis and the sacrum there, going up right around the ribs. And then you got the tight psoas in the front, which attaches to the discs in the spine there, pulling it downwards. So they're both going in opposite directions to force that curve. So a lot of times we tell people to work on bringing their body into posterior pelvic tilt to correct that. Here's a view from the front showing those tight hip flexor psoas muscles in the front, how they can pull on the spine, force it forward, and bring that tailbone up. Obviously, this is a problem because what's right here? This is the uterus right in there. It's coming out the bottom. So if there's distortions here, there's one hip higher than the other, there's joint inflammation, there's nerve compression, yes, it can affect the birth. Getting this all in line can help prevent breech presentations, especially you want to come early to the chiropractor. You don't want to wait till you're in pain. You want to get this in line because it's a lot easier to work on you when you don't have a giant belly. But we can still work on it. We've got specialized tables for that. And yeah, just easier birth, less pain, works out well. Here's another picture of the uterus itself. You can see in the back, kind of hazy, the spine and the sacrum actually attaches to the uterus via the uterosacral ligament. So, like we saw before with that side, the front to back picture with the tailbone being to the side, we can also have it rotated. It can move a lot of different ways. Not only will it affect the joint, but it can tighten up one side of this uterosacral ligament over the other, forcing the baby to turn. So we want to get that straightened out to prevent any breech presentations. This is the round ligament here attaching to the front of the uterus. There's the belly there, you can see. That runs down through the pelvis, so that can affect it too, and that attaches near around the vaginal area. So obviously they're connected for pregnancy. So one time you'll get sometimes pain in the stomach on one side over the other, and that's due to round ligament pain. I think we have a picture here. There we go. Just showing that pain pattern in the red there. So it can cause imbalance, and it can also create a torsion of the uterus, forcing maybe a breech presentation. So we want to get those muscles even. We want to get the sacrum even. We want the uterosacral ligament in the back here also to be even and balanced. Well, another thing we can see is sciatica, either from a nerve compression in the spine or sometimes it's from Piriformis Syndrome. So what happens when that tailbone rises up, like we saw on the side views, and can create tightness on either side in this piriformis muscle, which can compress the sciatic nerve, sending pain down the leg, which is just never fun. So a lot of things we teach besides getting your spine corrected is how to take care of your posture, figuring out which posture your body tends to go into, and teaching you how to correct that throughout your day. We call that life exercise. So it's not like you're in the gym, you're washing dishes, holding it. So a lot of times we're teaching you, if you're anterior, to hold it in posterior tilt to correct that. And then once you're in neutral, you can continue with your normal exercises. Here's just a few exercises to reverse anterior pelvic tilt. This is the squat, the deep squat. Notice how she's not sticking your butt out, she's causing it to drop. This allows these erector spinae muscles to stretch, which obviously are very tight if your butt is sticking up and the belly is going forward. So you want to loosen them up. And it also strengthens certain muscles when you're in this position. It's good to go a little side and right. And it's good to hold on to something too to help you achieve the right butt drop, I call it. Here's another way to do that. If you can't get into the squat, maybe you got bad knees, you can lay on your back, bring your knees up, and you're trying to tilt it into posterior, bringing it back. So you're sucking the belly button into your spine, flattening out that lumbar curve. Child pose is a good yoga move. So you're putting the belly right in between the knees, and you're bringing that butt down again, almost like you're in the squat, but you're laying. Once again, a little hard on the knees. So if you got knee trouble, you can try the one on your back. And this is just a great position. Could even fall asleep in this position sometimes. It's so comfortable. Not that I know from personal experience. So please visit Klein Chiropractic Clinic on YouTube. We have a few videos, and we're constantly putting up more videos on different conditions, and then we might even post one on pregnancy for you guys. And if you want any copies of those research papers, we'll have a few copies back there, or you can just search them on the internet through Google searches. Thank you.